thank you, organizer, for just giving me the opportunity. And I'm very impressed with the two previous speakers. They just taught us. So I will. There are lots of eye diseases which happen in the kids and adolescents. I will go through a couple of common eye diseases which pediatricians come across. So one is refractive error spectacles. Everybody knows. So this should be the ideal design of the frame the child should wear. It should be round and oval and not the rimless or something like that, or not that metal frames. So what they present, they complain to the pediatrician or parents about their visual problem. So they usually complain that they were not able to see the blackboard or television. They go close to the television. Then they might complain of eye strain, headache, squeezing of the eye. Headache is the commonest complaint, and the eye strains and the squeezing of the eyes. They may complain of watering when there is a astigmatism or cylinder. Then they may have face turn, or you people know it is called torticollis. These are the common complaints when the children they have the refractive or spectacles or chashme ke number. So when they come to the pediatric ophthalmologist, usually as being pediatric ophthalmologist, we put the cyclopedic eye drops to check the proper power of a child. Usually ophthalmologists they tend to put the simple drops which they have effect last for 4 to 6 hours. But to check the power up to 16 years of age, we put the cyclopentalate or homeotropin eye drops. The effect starts at 2 hours, so we check the power after 2 hours of putting the drops, and the effect lasts for minimum 48 hours. So we need to tell to the parents and children that they will have blurry vision for 48 hours. So in 18 years of practice, I have never checked a child power without putting these drops. So this would be in the knowledge of pediatrician. As everybody knows that there are 3 types of refractive error. One is myopia according to the focal point, second is hypermetropia, and third is astigmatism or cylinder. This is very common. So this is the example of everybody must have seen the spectacle prescription for the children or own self. So this is the myopia where you can see the minus 3.5 and minus 3.25. It is minus power. I will not go much into the detail or theory. Slide, no, not very. I think stick. Oh, okay. Sorry. So this is a case of you can see here. This is a case of astigmatism or cylinder, and this is a plus power or hypermetropia. Hypermetropia is quite different from the presbyopia. So whatever power people wearing plus power after 40 years is called presbyopia or betala. This is a hypermetropia. But commonest is astigmatism, and second is the myopia. So some facts and myths about the refractive or spectacles. Every parents they have, so pediatricians should know that spectacles, all spectacles has to wear entire day, and it is nothing to like that. It should be wear in the while reading or while watching TV or something like that. The child has to wear spectacles entire day. There is no other rule. Any dietary changes or any diet habit will not affect the power of the spectacles, and walking on the grass will not affect the power of the spectacles. And there are some parents, they have tendency to pour water inside the eye. It will not help at all. And you might have come across with some fake or quakes in the society. Those some homeopathic doctors particularly, they give the treatment to the children, and they claim that there are very well-known, people must be knowing, well-known people in the Ahmedabad. They are getting the awards from the celebrity, and they are claiming that आपके बच्चे का चश्मा निकल जाएगा. I have never seen, they are getting awards in the Times of India. I have never seen that एक भी patient का number निकला है. My friend, who's the anesthetist, they went to their for that treatment. They charged 50,000 rupees, and at the end of 1 year, there is zero outcome. So this, our colleagues should be knowing that. So this is a new concept. I think I'm just telling my friends that this is a myopia control management, and we are the pioneer in Ahmedabad. We started in 2018. So as per WHO, the current prevalence is around 15 to 20%. An estimation in 2050, it is going to be 50%. So this is a big concern for all of us. And as you pediatricians, you are getting so many children, so you should be knowing this concept. So what are the risk factors for myopia minus power, for development and for progression? So it is mainly basically lifestyle, right? So when there is one or both the parents, they have the minus power, the child is going to have a high risk of developing myopia. So what we can do, when there is a habit of excessive near activity like watching mobile or tablet or laptop, that their chances of getting development of myopia will be increased. So that one point we should know. And less outdoor activity. So sunlight has definite influence on the development of spectacles. जो बच्चे बाहर धूप में नहीं खेलते हैं, उनको चश्मे आने की possibility काफ़ी ज़्यादा बढ़ जाती है. So these two concept everybody should know. What are the hazards of myopia? जो minus numbers जो होते हैं, what are the side effects, what are the likely complications? One is they're likely to develop retinal detachment, or it can lead to blindness also. There are high risk of developing glaucoma, jhamar, जिसमें optic nerve get atrophied, and if power is very high, like more than -7, -8, then refractive surgery, what we call is LASIK operation, will be difficult after 18 years of age. So there are 3 treatment modalities. One is lifestyle modification. We advise to everyone. So everyone should keep their slide with them. Every pediatrician. And one is that to avoid the laptop and mobile usage, to avoid the screen time. I recommend them to use the television instead of mobile. If somebody wants to see YouTube, then I advise them to use the television instead of mobile or laptop. And many schools, they just give homework and all academic activity on the mobile. So I recommend them, they should use the screen, not the mobile, because the distance of laptop is quite far away from the mobile. So near activity should be avoided totally. There should be total abstinence. And there are so many studies worldwide that they recommend 2 hours per day. There are the literature in this literature available. The 2 hours per day outdoor activity, which is highly advisable, and that ultraviolet light has direct role on the sclera of the eye. It will prevent the onset, and it will prevent the progression of the spectacles also. And in like Singapore, country like Singapore, Indonesia, they have the epidemic, and they have their schools walls made up of glass. So they allow the sunlight to enter into classroom also. Second treatment model is the low dose atropine eye drops. So there are 3 concentrations available, 0.01, and we start this treatment at 4 years of age, once a day, and minimum treatment protocol is for minimum for 2 years, and success rate is 70%. We can continue till 6 to 7 years of age also. 0.05 is not available, so I dilute it and then give to the children, but it will be available very shortly. And third treatment modality to control the power is the special design spectacle lenses. What is the theory behind is that this is only a physics, that when there is a minus power, we usually, all of you, those who are minus power, they are wearing the concave lenses in front of the eye. So till date, what happened when we are wearing the concave lens, so focal point will be there on the macula, so everybody will see clear, but the focal line in periphery, it will be the outside the retina. So it will be a stimulant to increase the power very regularly. So according to studies, they have developed the specially designed glasses where in center the focal point will be on the macula, and in the periphery in front of the retina. So this will prevent the progression of the myopia. So there are specific design lenses. We started in 2020. So there are 3 companies available in the world. So we are using the Japanese company, and only barrier is the cost. Otherwise, there is no side effect because it is fitted in the spectacles. So it is not non-invasive treatment modality. So only barrier is the cost, but company they are providing good offer to the parents. And third most parents, pediatricians, they have many children they complain for headache. I have put this topic to just emphasize that every pediatrician, when children complain for headache, they should always consider the ocular problem and do not directly go out for the neuroimaging. So many parents they got anxious and they go for neuroimaging, and ultimately I have seen many patients with refractive error not properly checked, and by giving them proper spectacle power, they just headache gone. So one of the commonest is refractive error, second is computer vision syndrome, and we should always remember the raised intracranial pressure. As being ophthalmologist, we can first diagnose the raised intracranial pressure by papilloedema. So what is computer vision syndrome? So whenever any one particular children, when they are doing excessive near activity, gadget activity or mobile or reading excessive, their intraocular muscles, ciliary muscles and convergence muscles get fatigued. So when they get fatigued, then they will have eye strain as well as the headache. And second is a dry eye. So this is computer vision syndrome is universal. It applies to children as well as all IT professionals, those who are doing 6 to 7 hours per day minimum screen time. So we advise them 20-20-20 rule. Everybody must be knowing that. So we advise them to take a break at 20 minutes for 20 seconds and look at the far object of 20 feet. So it is one of the advice, and keep distance of screen, laptop or computer screen, desktop screen at 75 centimeters, not so close, and frequent blinking and lubricant eye drops. And coming to the raised intracranial pressure, when a pediatrician just refer us for the headache, we always see the optic disc, and we as an eye surgeon can see optics disc better than neurologists, because neurologists they have the ophthalmoscope, they cannot see the 3D perception. As being eye surgeon, we have another device where we can really appreciate the optic disc and the papilloedema. And this is my last topic. This allergic conjunctivitis is very common in children, and there are 3 or 4 types basically: seasonal, perennial, vacation, atopic. And treatment is conservative means cold compress or rubbing of the eye. We should always note that when pediatricians they come across with the allergic conjunctivitis, if they constantly rub the eye, then there can be keratoconus. So when they rub the eye, then in the cornea, the collagen tissue will get disturbed, and it will lead to damage to the cornea, and it may lead to blindness also. So when there is the allergy of the eye, always tell to the patient that not to rub the eye. And there are some treatment modality: antihistaminic, steroids, then tacrolimus eye ointment can be given, intraocular steroid can be given, and systemic immunosuppressant can be given when there is a blinding condition, right? Thank you.